Welcome back to Great Day St. Louis. I want to talk to you for a moment about something that touches millions of people across this country. Does your child suffer from ADHD? If so, have you ever heard of neurofeedback? Because the American Academy of Pediatrics gave neurofeedback their top rating when it comes to applying it to the behavioral symptoms of ADHD. Dr. Jason Rhodes with St. Louis Neurotherapy Institute is here to tell us how neurofeedback works. Good to see you, sir. It's been a little bit.
Yeah, it's been a little while, hasn't it?
So let's start kind of at ground zero here. Give us a good working definition for ADHD and what it is about neurofeedback that tends to help that.
Sure. So ADHD is attention deficit hyperactivity disorder. So you have a problem with focus, paying attention, sequencing events, so forth and so on. So for the last 15 years, we've been working with kids through something called neurofeedback. And neurofeedback is a form of EEG biofeedback. So it's a form of biofeedback. And we begin this process by placing a cap on the head that has all these different sensors that are recording the electrical activity of the brain. So the brain has these electrical impulses, and we're recording that, and what we're looking for is an underactivation of the frontal lobe. So this part of the brain that lives right up here in the front, right above your eyes, that part of the brain deals with what's called executive function. So, like I said, paying attention, sequencing events, so forth and so on. So we're recording this electrical activity, and then we get maps, and these maps can show us if that area of the brain is underactivated. If it's overactivated, it's underactivated. And so what we do then after that is that we do what's called neurofeedback therapy. So we place surface level sensors on the scalp correlated to that area, and we're recording that. And then when the brain activates appropriately, then they get a reward response. So the kid is watching a movie, and that movie gets brighter and brighter the more that brain activates. Wow. And so this is essentially just like when you go to the gym and you lift a barbell, you stimulate that muscle, makes that muscle stronger. That's what we're doing. We're saying, let's activate this brain, and that brain activates over and over again, gets stronger, and then we see reduction in the symptoms.
So in essence, over time, you are retraining the brain, just like you would strengthen that bicep. Here's what blows my mind too. This can be done remotely, right? You don't even necessarily have to be in the office. How does that work?
COVID. We owe that to COVID.
That makes sense.
So for a long time, we would have patients come to the office. We're centrally located right here in Creve Coeur. But we have the systems to be able to send this home. So we have people that travel from hours away. They come here, they do the testing, they get the equipment, and then they're able to train at home. We're able to monitor that and make sure that they're moving in the right direction, but it makes it really convenient. And so ever since COVID, everyone's like, I want to be able to do this at home. We're able to do that.
How often are patients doing this?
So typically between 3 to 5 times a week is what we're looking for. You can train every day. It's possible. But usually our programs last about 10 weeks, and we're trying to get in about 40 or 50 training sessions. It's about 20 hours of total training, but broken into half-hour training sessions.
All sounds great in principle, non-invasive, no pain. Let's talk results. What kinds of results do your patients tell you they're getting out of it?
So like I said, for 15 years we've been working with kids and have well over a 90+% success rate with this. And so that's, but we're seeing kids reduce medications, doing better in school, better emotional regulation, which is a lot of what we deal with. But yeah, we've seen thousands and thousands of patients at this point.
A lot of people might be interested, still kind of on the fence. You got maybe a deal that could bring some people in?
So we're offering $100 off for the first 10 callers for the testing. So the testing is really, we want to start with the consultation, learn a little bit more about them, their history, but then the testing is where it all comes down to see what's actually going on.
Yeah, and again, don't be intimidated by the imagery we showed you. There's no pain, there's no really sensation of any kind.
No, we've had little to no side effects. I mean, it's very, like I said, at the end of the day, it's biofeedback, but it's very sophisticated.
And at the end of the day, you're treating something that's very difficult to treat and having great results.
Yeah, have for a long time.
Good to see you, Doctor.
All right, thanks so much.
15 years he's been at this. St. Louis Neurotherapy Institute is offering $100 off the initial testing for the first 10 callers this morning. So call now, 314-983-9355. But you can also find them on the web. It's stlneurotherapy.com. Start your adventure there. A whole lot of information just waiting for you. Thanks again, Doctor.
Thanks a lot.